This is TapTrak, a spinal tap training assistant. Mannequin-based simulations use mannequins that mimic breathing, heart tones, and palpable pulses. These lifelike mannequins allow future and current physicians to practice true clinical skills in a safe and regulated environment. Training for procedures such as spinal tap, also known as lumbar puncture, are made easier with the aid of mannequin-based simulations. The skills physicians gain include palpation of lumbar spinous process, needle positioning and insertion, and collection of CSF. Current lumbar puncture mannequins have realistic tissue resistance and include a few interchangeable puncture blocks to simulate the standard spinal anatomy and varying levels of fat tissue. It also consists of a fluid reservoir to simulate CSF. We thought this experience could be improved, and so we spoke to a few medical students and physicians in this space. We asked Dr. Preetham Suresh what he thought was missing with the current lumbar puncture mannequins.
So I think the gaps in our current ones are the ability to simulate abnormal spine configuration. So scoliotic spines or sort of curved spines would be useful. The ability to simulate thoracic spinal epidurals is something we can't currently do, and it's a challenging procedure to do clinically, and so practicing in the simulated environment would be useful.
Next, we asked where his students tended to struggle the most.
I think it's the 3D understanding of when they encounter bone, when they're trying to access the intrathecal or epidural space and they hit bone, and they're trying to understand what that means, especially if they hit bone at different depths, to sort of reconstruct the model of the spine in their head based on what they're hitting and at what depth. And so that ability takes time.
We then spoke to a medical resident to see if this would actually help.
I think it may be useful for people who are less innately spatially oriented. We're all born with different sets of talents and skills, right? So I think some people, if they're not good visualizers in their mind of how the 3D tissue should be, or they haven't gained that ability yet, yes, it's very nice for them to see it, so they gain that ability. But it might be useful in terms of just giving them some feedback. For example, maybe people think they're going in a straight line because they're used to feeding in a certain way, but our fingers don't move in a straight line. If you maybe have some feedback, you can catch people who thinks they're making a straight line but can't justify it or can't see it, when in reality they're moving wildly about that maybe.
And so, TapTrak was born. We propose a modular system that helps construct a mental model using real-time feedback based on needle tracking and allows physicians to choose the kind of spine they want to work with. After turning on the system, the user proceeds to select the type of spine and inserts this into the main mannequin frame. At this point, the physician prepares the needle and begins the procedure. As the needle propagates through the skin, the physician is able to see the trajectory of the needle on the screen. And if this is successful, the CSF can be extracted. However, there are a few things that can go wrong, in which case the user will be alerted and they will be allowed to try again. We propose to redesign the current mannequin by mounting 2 cameras and a light source surrounding the spinal insert. The back mesh is embedded with piezoelectric sensors, which will indicate the starting position of the needle. For tracking, the needle will be painted black with bright spots placed along its length. In the dark, the light source helps the camera identify the position of these spots that can be used to display the needle trajectory in 3D space. On the left, we have Dr. Suresh performing a successful spinal tap. On the right, we have what he would see. Now on the left, we have Dr. Suresh showing a failed attempt as he hits the outer bone. The system would also detect if a physician hits the backbone or goes out of the spinal area. In addition to visual feedback, TapTrak will also provide inserts for different types of spines. These will include scoliotic spines for lumbar and thoracic. TapTrak will aim to provide a holistic training system whose features can be customized to a specific skill level. This means that a beginner can have more educational training aids that are incrementally taken away as they advance to an expert. The training aids include audio alerts, needle trajectory, and fault detection. In bringing these features to the training environment, we hope to help physicians transition from the simulated environment to a clinical setting more comfortably. The impact TapTrak creates on learning speeds can be evaluated in trials that include physicians that are trained with and without TapTrak. In addition to the procedural techniques, physicians also need to be comfortable with patient movement and their reflexes. In the future, the system can be extended to include augmented reality to mimic patient movement and provide cognitive feedback. With needle tracking, modular inserts, and patient feedback, TapTrak will be a comprehensive educational training tool.